Welcome to a demonstration of the content-powered Agentic Hospital. What I'm going to show you today is how Hyland's Content Innovation Cloud, alongside an on-base foundation, helps healthcare organizations move from managing documents to delivering better patient care faster. Because let's face it, healthcare organizations don't have an information problem, they have a context problem. We have the patient data, but it's disconnected, overwhelming, and lacks meaning in the moment it's needed. So today you'll see what happens when that changes and how more streamlined patient referrals lead to better clinical outcomes. Our story is a tale of two hospitals, Sunfield Regional Medical Center, a small community clinic, and Major Metropolitan Hospital, a large urban care center in the big city. Over at Sunfield, our patient, Mary Ann McKinley, is 41 years old. She came in this morning with chest pain and shortness of breath and is now being referred to Major Metro for a cardiac consultation. And in this moment, while it's not an emergency, the speed of the referral directly impacts how quickly she gets answers. As hospital staff at Sunfield, it's my job to fulfill the medical record request. Traditionally, this takes hours of human ETL, hunting across systems, determining what documents apply, and making sure nothing is missed. But with agentic release of information, this now takes minutes. From the records request dashboard, we can see that our priority agent has intelligently moved Mary's request to the top and flagged it as urgent due to chest pain in accordance with Sunfield policy, meaning that urgency is no longer something staff might miss or must determine. The system, our agents, understand and assign it. So let's complete the request so Mary can be scheduled as soon as possible over at Major Metro. You'll notice that her physician, Dr. Simon Tam, asked for all relevant records from 2025 and 26 be sent to the receiving hospital. So let's review the documents. And this is a pivotal moment. Why? Because the agent, not a human being, but the agent has collected everything requested, not just from on-base, but federated across systems. What used to take hours of searching and guesswork is already done. We're also alerted to something important. A relevant piece of content outside the requested date range was automatically included in our packet, again, based on Sunfield's release of information policy. In this case, the ROI agent recognized symptom relevance, identifying an office visit from 2023 that noticed chest tightness and difficulty breathing. This, my friends, right here is the Enterprise Context Engine at work. It understands Mary, her records, her medical history. It understands cardiac care and what's relevant here. And it understands Sunfield's governance policies, using this clinical context to assemble the exact right medical packet. And if you think about it, this document could be critical in determining what's next for Mary's care. This is the power of understanding context, not just conditions. And in mere minutes, the documents are compiled, the referral cover sheet is generated, and the packet is ready to send from on-base to the receiving hospital. Now let's shift to the receiving side over at Major Metropolitan Hospital, where we've just received Mary's packet. 81 pages of her medical life that would traditionally need to be manually separated, classified, and indexed all by hand. But now with Hyland's intelligent medical records, this work is now fully automated. What was once a single file is now 10 discrete documents, individually classified with a high degree of confidence. Here we see the agent's reasoning for the content type selection. Now, behind the scenes, our extraction agents have been hard at work extracting and capturing the patient data and matching it to the receiving system. But there are still a couple items that we need to validate. First, there are not one, but two Dr. David Lynch's over at Major Metro, which we know because we queried Epic via FHIR. However, our clinician routing agent understands that this is a cardiology referral, the context here, and it confidently suggests the correct physician. So all I need to do is accept. What we are seeing here is so much more than just OCR and text extraction of the past. This is agentic document execution that understands context. Second, part of this packet contains lab results, typically some of the most difficult data to capture, but not anymore. What used to require heavy human energy, we now extract effortlessly using Hyland's intelligent clinical results extraction, delivering structured table data directly to Epic via HL7. And in this case, if we have an instance where the system isn't confident, all we have to do is review and accept. And in mere moments, Mary's records are received, structured, and routed with no downstream rework. And for the treatment team, the impact is ready to use clinical data with very little lift. Now I'm in the shoes of the cardiology treatment team in the office of Dr. David Lynch. And when I open Mary's chart within the Hyland clinician window, I get a complete patient view, an alert to the new referral documents that we just received from Sunfield, and an AI-generated summary of Mary's recent visits and medical history, surfacing key highlights from a cardiac perspective. What used to take time to read and interpret, remember that our referral packet alone was 81 pages, is now delivered as concise, actionable insights. So now that I understand the case at hand, the next step is determining what to do. And this is where our Agentic policy guide comes in. I can ask treatment guideline questions against organizational policies. And the answers I receive, the guidance, are clear and it's grounded. And this is huge in major metros clinical procedures, national treatment guidelines, and Mary McKinley's patient data. And this is where everything comes together as contextual clinical insight, delivering decision support for Mary's care team. And this is one of those pop the champagne moments, not just for Mary, but for all of us as potential patients, because the more the treatment team knows, the better care they can provide. So you might be out there wondering, how did all this happen? Well, before we close, let me pull back the curtain for just a moment and showcase our unique architecture, namely Hyland's strategy of applying agentic AI to a trusted content foundation powered by the Enterprise Context Engine. Behind our AI agents is a clinical knowledge graph, a living data model that represents and organizes patient data and hospital policies as an interconnected network of entities and their relationships. So instead of traditional rigid rows and columns, Hyland's out-of-the-box healthcare ontology models information the way clinicians actually think, as a complex web of relationships, context, and meaning. And the result is a real-time, queryable, AI-native content and data fabric of Mary's full medical story. And this isn't something that you have to build from scratch. We're delivering the Enterprise Context Engine with ontologies that are purpose-built for healthcare and other key industries that we serve. And the result is a complete picture at point of care. This is what it looks like when content becomes context and context drives care. We started with Mary Ann McKinley, 41 years old, short of breath, waiting for answers. And what you just witnessed from patient referral to receipt used to take hours, handoffs, and quite frankly, hope. Now it happens in minutes with guardrails, governance, completeness, and most importantly, confidence. And for Mary, this means she's scheduled sooner and she gets answers faster, reducing risk, uncertainty, and stress. When Hyland handles the healthcare content complexity, clinicians get clarity, and patients like Mary get better care. This is the real impact of a content-powered agentic hospital for all of us. For more information, visit hyland.com.